Hello, everyone. It's good to be back again for another head talk on a very interesting subject, a topic that is known as diabetes. I hope you enjoy my last two episodes on the diabetes. I hope I've been able to allay your fear and anxieties. I hope you have learned one or two things about diabetes, and I hope I've been able to change your impression about diabetes. And we spoke about type 1 diabetes, we spoke about insulin, what the causes of type 1, and how we can manage the type 1 diabetes that will not lead to complication. Yeah, let me quickly introduce myself. My name remains the same, Deborah Wilson. I'm a nurse and midwife by profession. I'm also the president of Enablers Diaspora Grassroots Support Outreach. Without wasting much of our time, let us sit down and relax, and let's try dive down to the world of type 2 diabetes. Now, what is type 2 diabetes? Type 2 diabetes, this develops when the body can still make some insulin, but it's not enough. Your body is producing insulin, but the insulin that is being produced is not enough. Or the body is producing the insulin, but the insulin that is being produced is not working properly because of resistance, and this is what we call insulin resistance. And the signs or symptoms of type 1 and type 2 diabetes seems to be the same, but the difference is in type 1, remember I said our body is not, in type 1, the body is not producing insulin at all, and they have to look for artificial ways of injecting insulin into the body to metabolize. But in type 2, the body is producing, is not enough, or is meeting resistance. Now for type 1 that is not producing at all, of course the symptoms will be conspicuously glaring, but in type 2 the body is producing, and most people, they don't diagnose them as type 2 diabetes until when the complication develops, and that is when they now realize that they are suffering from diabetes. Now, let me talk about the treatment of diabetes. In treating diabetes, it requires lifestyle changes. And in terms of healthy diet, weight loss, the increase of physical activities, and the medication, which might be in form of tablets, and tablets can be combined with insulin. And also, some will combine tablets, insulin and tablets together, or medication, oral medication alone. When you are being prescribed oral medication, what does it do? The oral medication aims at, the aim is just to lower the blood glucose level. And I need to correct this, that it does not cure diabetes, because most people will have to take it for the rest of their life, and for the rest of their lives, and that is why it is being referred to as chronic diseases. But for the fact that you have to take it for the rest of your lives, it does not mean that you are not going to live long. No, you can live long, you can live up to 100 years if you know how to manage either type 1 or type 2 diabetes properly, and you prevent the complication. So now I will talk about the general rules in terms of managing diabetes. So we have the dietary rule. The rule is, we said we aim at a healthy lifestyle. We reduce salt intake. This is very, very important. If you are drinking alcohol, you drink it in moderation. You eat at least 2 portions of oily fish in a week, and limits the sugar or sugary things that you consume. These are few of the general recommendation in terms of dietary management of diabetes. And also we aim at having 5 fruits a day in conjunction with the medication that we are being given. Not only this, in managing type 2 diabetes, there are few specific ones that we have to sort of take notice in form of low glycemic index diet is highly recommended, and salt restriction. You don't put too much salt in your food. Some people, when they already prepare their food, that is when they now have the taste and say, oh, please bring more food, bring more salt and raw salt. This is very wrong. It is very important to reduce salt intake in controlling blood pressure, and also what we call Desmond, that is personalized dietary advice, which considers the individual's needs and cultural belief. And I said it earlier on that eating a balanced and healthy diet is very important in the management of type 2 diabetes. And we need to aim at achieving and maintaining a healthy weight is also extremely important. If you are able to manage this properly, we won't have any complication of diabetes. Now I will explain to you briefly about the complication that can arise from diabetes. Complications of diabetes is divided into different categories. I will talk about the cardiovascular disease. How can diabetes, I say uncontrolled, let me put it, diabetes, how could it affect our cardiovascular system? We might end up with high blood pressure, with heart failure, with angina, with heart attack, with peripheral vascular disease, and it might end up with having stroke. And another complication that we have to look after and prevent diabetes is what we call the diabetic nephropathy. Anything nephron that has to do with kidney. So what happened here is the diabetic nephropathy is the leading cause of chronic kidney diseases that we call CKD. What it does is there's a damage to the blood vessels in the kidney that causes the impaired filtration. And also it can be prevented by delaying by good control of blood sugar and the blood pressure. If you have diabetes, you should have your urine checked, and also for the portion of at least once in a year you have to do what we call diabetic screening. And again, there's another complication of diabetes that is called diabetic retinopathy. Anything that starts with retinol, that means it has to do with retina. It's got to do with your eye. And what do we mean? How do we go about that? That means because of high blood sugar, it damages there's a damage to small blood vessels supplying the retina, which might lead to blurred vision and worsen the eyesight. Another very important complication of diabetes is other eye problem like cataract. Research shows that 60% of people with uncontrolled diabetes, they have greater risk of developing cataract. And people with diabetes retinopathy also, they face a greater risk of developing what is known as glaucoma. And another very important complication of diabetes that we cannot overlook is diabetic foot ulcer, poor circulation of the feet and leg, which can cause tissue damage, and also nerve damage, that is loss of sensation, that is what we call diabetes neuropathy. And if this happens, it's not well controlled, diabetes increases the risk of amputation, which might be of the toes or feet or lower legs. We need to try as much as possible to prevent these complications from developing. I spoke briefly about neuropathy. Neuropathy, that is the nerve damage aspect of the complication, and this involves the peripheral, where there will be reduced sensation, especially on the face. The person will not feel the lower limb, and it increases the risk of developing foot ulcers and amputation. And other complications might be increased risk of depression. It's very common in diabetics, and erectile dysfunction is very common as well. And the complications during pregnancy to the mother and baby. Also, diabetes weakens immune system. I will stop here, and please feel free to and subscribe to our channel. We are on Facebook, we are on YouTube, and we are on Instagram as well. I still remain yours. I'll come back there with another important earth topic another time. Thank you very much for watching. God bless.